Anxiety, loss of energy, feelings of guilt or hopelessness, thoughts of self-harm or suicide. These are all symptoms of depression, known globally as the most common mental health condition. The government of Guyana, through the Ministry of Public Health and the Mental Health Unit, has implemented a holistic approach to target and treat persons silently working through mental health challenges. In a brave first for government in action, Ms. Shama tells us her story of recovery from an isolating depression she didn't even realize she was struggling with.
I met that was when I started going to the clinic. I had suffered a stroke about 6 years ago. And from then, I just feel down. And then I started coming to this clinic for about 3 years now. And the first doctor I saw was Dr. Daniels, and she was very patient with me. That I have to thank her for. I'm a diabetic, so I joined the clinic. She says that I have many symptoms of depression. So she started treating me. She prescribed some tablets for me, one every night. Now I'm more outgoing. Before I don't want to go anywhere, I don't want to see people. But now when my daughter tells me, "Mommy, ready, let me go walk this way," I would go. But before that I never used to go. I never wanted to go. I mean, it's real, yes. But without she prescribing that I have depression, I might have continued living the same way and being the same type of person. I consider myself well recovered from it. I would say that it's not something to be ashamed of. It's a real sickness. But take your medication and you will survive it. There was a time in my life where I was feeling down. But no, after medication, I don't feel that way. I didn't consider myself a depressed patient. I didn't think it was depression had me. I thought because I had the stroke, that is what had me down, but it wasn't. Something to be ashamed of. When Dr. Daniels told me about the depression, I wasn't ashamed of it.
Dr. Tamika Daniels Williamson diagnosed and treated Ms. Shama, and while this case is considered a triumph, Dr. Williamson explained that sadly, some persons exhibit symptoms of depression and other mental health conditions, but avoid seeking out treatment because of negative stigma.
So, generally, I think because years and years, mental health is usually associated with stigma and discrimination, and I think the whole Guyanese population have this issue with, if you have a mental health condition, automatically is that you're mad, failing to realize that mental health encompasses a whole variety of conditions. It could be anxiety, it could be person suffering panic attacks, bipolar disorder, depression, a lot of things, PTSD, that is not schizophrenia. So I think the whole barrier to persons coming to talk about mental health issues is that they're afraid of the stigma attached with mental health conditions. They're afraid of being cast aside by society, even by their own family members. They're afraid of losing their job. The change needs to start first with us, right? We need to educate the public that these persons, they're still humans, they still have rights. Just like how I have a right to work and earn, I have a right to an education, these persons have the same rights. So that's a very important barrier, I think, the stigma and the discrimination linked with mental health conditions.
Dr. Daniels Williamson has also participated in the World Health Organization's Mental Health Gap Action Program, MHGAP, which trains medical professionals to better handle mental health conditions in countries where resources are sometimes scarce. The specialty-specific education, she says, allows her and her staff to welcome all patients without judgment.
Since I'm here, we've been edifying staff. We do health talks frequently. I address this topic frequently, so my staff is well aware. Some of my staff were also trained on the MHGAP program, so persons are aware, and they're encouraged to be an advocate for these individuals, right? They understand that these persons can come and they understand the peculiarities associated with these mental health conditions, and so we make no hesitation to see these persons. And I'm a key person here at the health center that deals with these issues, so whenever I'm available, even from the mental health unit, patients are sent for me to assist, so I deal with it right away. Right? So there's no issues with seeing these patients.
While the ministry welcomes increased treatment and recovery of mental health patients, institutionalization is the last option. Head of the mental health unit, Dr. Util Richmond Thomas, explains.
And so my role will include governance and standard setting and surveillance of all the mental health programs that are going on in the country, as well as we have to create our own programs according to the needs of the population, and also according to the international standards. At the moment, we are in the process of transitioning from institutional care to community-based mental health. So it means that we have to beef up the capacity of primary health care and the community facilities to take care of patients at the primary health care level in an adequate fashion, rather than hospitalizing them at the National Psychiatric Hospital. Worldwide, countries are moving away from that kind of model because we find that it's a waste of resources, and more than 70% of the patients can be managed at the primary health care level on an outpatient basis. And it is much better for the patient because there are better patient outcomes, their lives are not disrupted, and then when it is time to reintegrate them, it's a lot of stress and so on. And they do much better when they're close to the family and friends that they love. All right, and they can go to work, go to school, whatever. So we're moving towards that model.
Dr. Thomas stressed that the early diagnosis is crucial to prevent the mental health conditions from progressing to a level where institutionalization is necessary.
The mental health unit is training the doctors in primary health care to treat all the major and most common mental health issues. So when the patient presents to primary health care, these doctors are there and they're diagnosing and they're managing those patients, and they're getting them in the very early stages, so the patients are not complicating to get to the specialist service like GPHC or the National Psychiatric Hospital. And we have seen a lot of progress there, because even as we speak, the admissions to the psychiatric ward at the Georgian Public Hospital has decreased significantly. And so far we've trained more than 300 healthcare workers and more than 150 doctors. So they are out in the community at their various posts and so on, and detecting and treating mental illnesses in their early stages.
Speaking to the cultural stigmatization of mental health issues, Dr. Thomas said, what is shown in the movies and on TV is not an accurate representation of the average mental health patient. The unit, she says, combats this stigmatization with a robust education program.
It is a very bad misrepresentation, because what you see in the movies represent a very, very small percentage of the patients in mental health. The vast majority of patients don't look like that. Through education, mainly. We are very robust with that. We have so many aids, posters, pamphlets, educational material, videos, and so on. And we do a lot of educating of the healthcare workers. We go to schools, we go to fairs, outreaches, places of occupation. We do all that. And, so we have a very robust promotion and prevention program where we're teaching persons how to care for themselves, how to prevent having a mental health issue, first of all, and then we're teaching them about the most common ones. We're focusing a lot of alcohol and substance abuse because we find alcohol and substance abuse has been a very disturbing issue in the society, and it's quietly doing a lot of damage.
The unit's robust awareness campaign can be particularly helpful in the classroom setting. For example, in the past, students struggling with mental health conditions like attention deficit hyperactivity disorder, ADHD, have been seen as bad students. With the right instruction, however, educators can learn the symptoms of these conditions and begin helping their students rather than punishing them. In a push to catch mental health patients at the community level, the Mental Health Unit, in collaboration with the Wellness Center and Save Guyana, have begun training support group leaders who will target persons struggling with self-harm and substance abuse throughout the country. This initiative, Dr. Thomas says, will be up and running by mid-July.
And the figures that I would ever see from the mental health unit as it relates to youth mental health, it's startling. So I needed to create something to help fix that problem. And being a youth myself, I would have said, okay, it's the perfect platform for me to get into. And people in Guyana, they really and truly don't understand mental health. The minute you say you have a mental health illness, they automatically label you as mad or crazy. And when in fact it's much more deeper than that. So I think we really and truly need to break that barrier and that stigma, and we can't just talk the talk, but we need to walk the walk in terms of providing the support. So yes, we're raising the awareness, but we're also backing it up by helping those that truly need it. And the support groups are, in my opinion, the perfect way to start that process.